Mananasidus todos hamzu. Mic is not on. Good morning, good morning. There we go. Mananasidus todos hamzu. Thank you very much for being here this morning. Welcome to the 38th Guam Legislature, the Guam Congress Building, the People's House. This morning's budget hearing is conducted by the Committee on Finance and Government Operations and is called to order at 0907 this Thursday, May 14, 2026. First notice of this public hearing was disseminated to all senators and media outlets on May 7, 2026, with its second notice disseminated on May 12, 2026. These hearing notices were also made available on the Guam Legislature's website, our legislative calendar, and the Government of Guam's public notice portal. The committee will hear testimony on the following on the agenda. Bill number 266-38, Committee on Rules by request of Magaʹhågan Guåhan, the Governor of Guam, an act making appropriations for the operation of the executive branch of the Government of Guam for fiscal year ending September 30, 2027, making other appropriations and establishing miscellaneous and administrative provisions. The focus of this hearing this morning is the FY2027 Budget Requests for Department of Public Health and Social Services. At this time, I would like to welcome my colleagues who are joining us this morning. First of all, the Chair of Health, Senator Sabrina Salas-Mantanani. Thank you, Madam Chair. Also, Senator Sean Gumatautau and Senator Therese Terlai. Thank you, colleagues, for joining. Before we begin, I'd like to remind everyone in attendance of the Legislature in Guåhan's general rules of conduct. Individuals testifying shall first be recognized by the chairperson before speaking and shall state their full name for record-keeping purposes. Questions and testimony shall be confined to the substance and the nature of the bill that's on the agenda. Personal inferences to the character or motive of any senator, individuals testifying is not permitted. The chairperson of the committee may order the removal from this hearing of any member of the Legislature in Guåhan or public audience who fails to observe proper decorum pursuant to the 38th Guam Legislature's standing rules. Any violation of this general rule of conduct will result in immediate removal from this public hearing room. With that, we'll now proceed to hear testimony on Bill 266-38 COR. I'll recognize the representatives of Department of Public Health and Social Services for their presentation and opening statement. But prior to that, we will have them please rise. Anyone who will be testifying on the bill that's on the agenda, the budget, please rise to be recognized and sworn in by the Sergeant-at-Arms. As you know, this is customary whenever we're dealing with financial matters. Yeah, so you may just want to go ahead and get sworn in. Yeah, you're exempt, sir, don't worry. We recognize that you will be truthful.
Please raise your right hand. Under penalty of perjury, do you affirm that any and all information you provide today, whether it be verbally, electronically, and in writing, be the truth, the whole truth, and nothing but the truth? Mr. Chair, on oath, you may proceed.
Sidus Masi and Director Therese Sariola, you're recognized to open with any comments that you have, as well as your presentation. It looks like a relatively lengthy one, so we're very happy to get a lot of detail this morning. Sidus Masi.
Thank you, Chairman Dueñas, Oversight Chair Salas-Mantanani, Senator Gumatautau, Senator Therese Terlai. Thank you so much for being here at 9 a.m. And thank you to everybody, my division chiefs who have joined me, as well as Deputy Director Peter John Camacho. I would just like to say, Manana Siduas, thank you very much for having me. I don't have any opening statements other than I have a very robust PowerPoint, and hopefully that will answer some of the questions beforehand, and so we can go straight to the presentation.
Certainly, please proceed.
Thank you. Okay, so it looks like it came through. Good morning, everyone. I will be presenting on the Department of Public Health and Social Services FY27 Budget Request to the 38th Guam Legislature. Next slide, please. Just a quick overview. We do have 7 divisions, and you do have copies of the slides as well as in the presentation on the overhead. Those are the divisions, where they're located, and the title of the chiefs. Division of Children's Wellness, Heidi Kanata. Division of Environmental Health, Mr. Tom Nadeau. Division of General Admin, Ken Blas. Division of Homelessness and Poverty Prevention, Robert San Augustine. Division of Public Health, Catherine Ankow. Division of Public Welfare, Francine Salas. And the Division of Senior Citizens, Charlene San Nicolas. Next slides, please. This is just our overall enabling legislation. Of course, public health was created by 5 GCA Government Operations Chapter 3, Department of Government of the Government's Article 1, Subsection 3111, Department of Public Health and Social Services. Our mission is to assist the people of Guam in achieving and maintaining their highest levels of independence and self-sufficiency in health and social welfare. Our vision is to see a community of empowered individuals with healthy minds and bodies thriving in a safe and nurturing environment across every stage of life. Next slide, please. Next slide. Yes. This is our organizational chart for you to review. Next slide, please. And then we get to the meat of things. The Department of Public Health and Social Services FY27 Budget Requests by division. Senators, you see a division breakdown of a total request from the general fund of $273,488,245. The Division of General Admin is $4,655,607. Division of Public Health, $4,538,942. The Division of Public Welfare, $232,632,203. The Division of Homelessness and Poverty Prevention, $1,108,564. The Division of Environmental Health, $3,157,734. Division of Children's Wellness, $13,088,117. And the Division of Senior Citizens, $14,307,078. For a total of $273,488,245. You do have additional supplemental requests. I needed to add that in because this is information we received after the budget submission. I'm looking at an additional $2,788,667 for a grand total request from the general fund of $276,276,912. Yes?
General fund is just
General fund is 80,000, but we have a federal match request. It doesn't, I'm sorry, we don't have that breakdown. It was just the total budget of $273,488,245, but the general fund request is $77,918,824 with a supplemental of $918, $1,870,667 for a total request of $80,708,491. I think, yeah, we can give you a copy of that breakdown. We just showed the general. Request. So the general fund request again is $80,708,495. Special funds, $3,277,258, with a total of $273,488,246, but we have a supplemental request of $918,000 for the additional Medicaid cap that came in after the budget was submitted, and an additional Medicaid APDs for modernization of $1,876,667 for a total request of the general fund of $80,708,491. And we'll go on. Next slide, please. So I'll be going through the divisions, and we'll start with the Division of General Administration. Next slide. So I started every division slide with topics of interest or hot topics of interest. And so I wanted to share with the legislature that by the end of this summer, purchase orders were awarded and an invitation of bid will be pursued for the remaining divisions. But public health and social services, one space will be moving out of Hessler, and we will be at the end of the summer. An IFB was put out, proper responses came in, and it's been awarded. And so for everyone's information, by the end of summer, we will be moving out of Hessler and going to Park Place or One Place across AK to Mooning. And that will be the department, the director's office, as well as the Division of General Admin, as well as the Division of Public Health will be coming together. Regarding increments, I know it's very important, and I've always stated to the team at Public Health that it's important to pay our team and our staff well and on time, and I'm happy to report that 98% of all increments or work WPPEs are up to date as of March. So staff has been getting their increments when they should be. In the past, there was some concerns, and that's why it's in the topics of interest of the delay of staff increments. So that has been resolved. Prior year obligation, all divisions are working on ensuring that all invoices for prior years are paid in this fiscal year. Next slide, please. This again is just the Division of General Admin. We're looking for this division, $4,655,607. The breakdown of unclassified, classified, and vacant funded are there in the lower block, lower left. The operational cost breakdown, 44% personnel, 56% operations. The variance is a decrease. And to date, this fiscal year, our burn rate is at 42%. Next slide, please. Division of General Administration mission statement, of course, is to provide the entire department-wide administrative support functions to the divisions, the other 6 divisions. Offices are identified on the slide. All the different programs. One of the main programs is the strengthening of course, the infrastructure, workforce, and data systems in the Division of Administration with the Public Health Infrastructure FIG grant. To date, we have received $11,690,181 for the period of 5 years, from 22 to 27. That grant will end in 2027, next year, November. Also, HPLO is under our division, and of course, they're committed to pursuing the highest quality of care through education, communication, licensing, legislation, and enforcement for all boards. Next slide, please. I've listed the accomplishments and initiatives of this division. I think the most important accomplishment for the division is us seeking accreditation for the department. And we did Our initial accreditation, we submitted an application in November of 2025 with the goal of achieving full accreditation by June of next year. FAB, or the Public Health Accreditation Board, approved the application in December of 2025. HPLO successes, we've implemented an online theory testing in October 24, practical exams in October 25, and the Guam Board of Barbering and Cosmetology. Furthermore, HPLO has successfully administered multiple certified nursing assistant CNA examinations, achieving 100% digital broadcast rate for all board meetings to ensure public transparency and transitioning to digital licensing. Some of the initiatives they're working on, Public Health is updating 8 major departmental plans: Community Health Plan, Community Health Assessment Plan, Community Health Improvement Plan, Organizational Strategic Plan, Performance Management System, Workforce Development Plan, Quality Improvement Plan, Emergency Operations Plan, Continuity of Operations Plan. HPLO is also working to roll out the online applications for 8 additional boards and plans to launch the Pediatric Readiness Recognition for Guam with the Guam Memorial Hospital Authority. And that concludes the presentation for the Division of Administration. We will go towards the largest division of the department, the Division of Public Health. Next slide, please. Topics of interest for the Division of Public Health. I think one of the greatest things we can talk about under the Division of Public Health is the immediate future ribbon cutting for the Guam Public Health Laboratory and Training Facility, located in Magaʹhågan in partnership with Guam, University of Guam. And we expect a ribbon cutting in July of 2026. Another CIP project that we're very proud of and happy to realize very soon is the expansion of the Northern Regional Community Health Center. If you've been there lately, you will see construction in the front of the Northern Clinic, and our target is actually next month. It's pretty much there. Again, that will help with the main entrance, modernization of the lobby and patient waiting area, and upgrading the registration area. So an expansion of the check-ins and medical records office as well. There's always been a question about, is there enough healthcare providers at the Community Health Center? And I'm proud to announce that the CHC have 17 healthcare providers to date, which consist of 1 OBGYN, 3 family medicine, 2 internal medicine, 6 pediatricians, 1 nurse midwife, 3 nurse practitioners, and 1 clinical psychologist. So the CHC is a very well-rounded, well-broad primary care center. Also, another hot topic, or lots of questions come up for us, is what steps have the Community Health Center have taken towards achieving autonomy under Public Law 38-97? The Community Board, the Community Health Board, is preparing to approve the CFO job description, Chief Financial Officer, very important to stabilize the funding before they go autonomous, and the development of business and financial processes and systems to support an autonomous infrastructure. Next slide, please. At one point, there was a lot of questions about the opening of the CHCs. So just as a plug-in to those listening, our Northern Clinic is open 8 to 5 Monday through Saturday, and the Southern Regional Community Health Clinic is open 8 to 5 Monday through Friday. I should plug in, that's not on the slide, that we take all all insurance except for Medicare, which we are applying for and hoping to receive shortly. But again, the notion that the community health center is not for everybody is incorrect. We want the people of Guam to know that the community health centers of the North and South are your community health centers. If you are looking for a primary care provider or a clinic to call your own, please consider the community health centers of the North and South. There's also been discussion about when can the Southern Regional Community Center provide urgent care. Senators, currently, the Southern Community Health Center does not provide urgent care because we operate under a HRSA-approved scope of work that only prioritizes primary, preventive, and chronic care. However, we are not close to it at all, and we will include the urgent care services requests in the next grant application period in 2027. So hopefully, if we get approved, we will not only be a primary care center, but also an urgent care center in the next application to HRSA in 2027. What is the status of specialty clinics, services that previously operated at the former public health facility in Magaʹhågan? These are the specialty clinics of tuberculosis, leprosy, sexually transmitted diseases, HIV, maternal and child health, maternal infant and early child home visiting, are all currently serviced out of the Northern Regional Community Health Center. There is, despite the exodus from the Magaʹhågan Center, early 2019, maybe 2020, none of the clinical services ever went away. We have always continued to provide those services, just in the different location, and that is being performed in the Northern Regional Community Health Center. Next slide, please. Okay, the budget slide for the Division of Public Health. We are requesting $4,538,942. 66% of that comes from personnel, if you look at the cost breakdown, 34% operations. Please note, don't be alarmed, we have much more operations, but on the federal grant side that we don't discussed in this budget because it's federal. We have a breakdown of personnel in the lower left hand, classified, unclassified 8, classified 34, vacant funded 10. Our burn rate right now for this fiscal year, of this fiscal year's expenses and budget, is 43%. Next slide, please. This is the slide of just basically the overview of what the Division of Public Health mission statement and what they oversee, and you can read that at your leisure. Next slide, please. Continuing overview of the many things that the division is responsible for to execute. Next slide, please. This is a slide that, for the recent typhoon that hit our island, mostly our parks and our shoreline, but we were honestly spared because it could have been a Typhoon Mawar all over again or worse. And we pause and give and keep our prayers to our Northern Mariana Island brothers and sisters who are really struggling today in their recovery. But Guam, fortunately enough, was not as greatly impacted by the typhoon, but not to say it was not impacting to our lives, because many of us, of course, did not have power for days and weeks. But I just wanted to break down, just so, because it's fresh in our minds, what the Division of Public Health did in response to the typhoon. For the first time ever, the community health center, I ordered them to stay open. Why is that important? Because it moved the traffic from GMH for non-urgent care to the community health center, as well as we wanted to very much be there for the community who were oxygen dependent and knew that either their power was going to go off and they would not be able to survive without oxygen. In addition to that, so we were open during the entire storm, and I thank the hardworking providers who braved that and stayed away from their homes to be available for the people of Guam during the storm. We also partnered up with Red Cross, and our healthcare staff rendered acute care services at the Tier 2 shelter. When the DOE shelter closed, the Tier 2 shelter manned by Red Cross opened up in Jim. 49 patients were seen from April 20th to the 21st, including their follow-ups. We also did immunization outreach at the mall on April 24th and assisted another total of 41 patients there. The Bureau of Family Health and Nursing, their response to Sinlaku, they assessed 2,818 residents. Of course, that's duplicate counts at the Tier 2, meaning encounters, 2,818 face-to-face encounters with the Tier 2 population. Next slide, please. The Division of Public Health, through the Bureau of Communicable Disease, on April 23rd, 40 executed at the Tier 2 shelter pertussis and flu immunization. 40 total patients were screened, 31 total patients were immunized. April 24th, we had child immunization outreach at Micronesia Mall with 63 total patients screened and 63 total patients immunized. Next slide, please. So from Sinlaku slides, I have listed some of the highlights, and it's definitely not all the highlights. When preparing for the budget, Division of Public Health, which is the largest division, gave me pages and pages of accomplishments. And if you want that, we can give that to you. But I figured that I will just really highlight the highlight of the highlights. And so, of the accomplishments of the lab, of course, was the planning kickoff to plan for the lab that we're scheduled to open this summer. And then, of course, under the lab, on March 27th of this year, we established the Laboratory Information Management System and Laboratory Data Exchange for the first time. July of 2025 to April 26th, CDC National Surveillance Cooperation for Local Specimens were achieved. Office of Vital Statistics, so these are all the offices and all the bureaus that fit under the Division of Public Health. Office of Vital Statistics, January of this year, we launched the electronic death registration system that was supported by epidemiology and laboratory capacity. And we're so pleased because soon we will have online electronic registrations for other things. Right now it's electronic death that was completed. The next is, we'll be getting into is birth, but that's quite extensive. So we started with the death registry. The Bureau of Alternative Medicine, as you can see, held the first summit in January of 2026 of this year. April of this year, the presentation of the Guam Lead Poisoning and Prevention Program was achieved and in the meeting in Honolulu. The Bureau of Communicable Disease Tuberculosis Program contained a multi-drug resistant outbreak and completed treatment of 2 pediatric patients, first time in Guam. Guam was selected to be the host of the Pacific Islands Tuberculosis Association Conference. The last time Guam hosted was in 2009, 17 years ago. Advance notice of new school vaccine requirements for HPV vaccine to be implemented in this upcoming school year. August of this year, or last year, I'm sorry, we hosted a full-scale regional health exercise called Fire on the Horizon that brought in all the health leaders from all the region. In January of this year, we rolled out a regional disease conference entitled Guarding the Pacific in the Age of the Avian Influenza. So again, just some highlights. I have pages and pages of accomplishments, but we'll be here for days. Next slide. Again, bureaus and offices in the Division of Public Health and some of their highlighted accomplishments. You have the Bureau of Family Health, the Bureau of Non-Communicable Disease. I want to stop here with let me go back to the Bureau of Family Health and Nursing. We successfully advanced through phase 1 of the home visiting program re-accreditation, demonstration readiness, and that is ongoing. The Bureau of Non-Communicable Disease. I want to highlight, last year we highlighted our mobile clinic. You might have seen that around. Immediately we wanted to make sure that the mobile clinic did what it's meant to do and to go and meet people in the community. So we started in October and we have visited the villages of Guåhan, Magaʹhågan Heights, Talafofo, and Piri thus far. The Bureau of Nutrition Services, or known as WIC, achieved 99% satisfaction in their WIC survey, sustained increase of breastfeeding rate from 63% to 64%, and telehealth services for nutritional education and other services were launched. The Bureau of Primary Care, of course, we talked about that a little bit in the highlights earlier, known as your community health centers. And again, we onboarded from the last presentation last year, 5 additional health providers. And we implemented PrimeRx, which is the CHC's pharmacy software, in December of this year. Or last year, I'm sorry. The Office of Epidemiology and Research. It's not listed here, but I do want to say that we have now a classified permanent territorial epidemiologist and by the name of Patrick Soto. And that's really important because we've been always having an acting, and it's important to have stable leadership in epidemiology, especially in the public health field. We have completed the 4th postgraduate certificate in epidemiology cohort, which has 10, and to date, 29 completed that. We collaborated with the National Governors Association and Johns Hopkins for the Outbreak Response Innovation Policy Academy in developing Guam's Field Epidemiology Outbreak Manual, and we supported the development of the Health Islands Vision 2050. Next slide, please. Okay, it's under initiatives because it wasn't accomplished yet, But again, I want to repeat, we're very pleased to anticipate the opening of the Public Health Lab this summer in 2026. And it's not only, we are blessed because this is a Department of Interior funded facility. It is not just for our community of Guam, but it's a regional lab that the entire region can bring forward their specimens to us and have quicker response times so that decisions in their highland jurisdictions can happen quicker. The Office of Epidemiology, some of the initiatives they're still working on is the proposed amendment of law governing reported diseases, mandatory reporting, and we are waiting the AG's response in that. Ongoing project for statistical data gathering for OVS annual publication is also ongoing. Again, these are initiatives that haven't been achieved or completed, but we are highlighted initiatives, big initiatives that we're working on. OVS, fetal death registry is being worked on and planning to go live next month. As I mentioned, we already completed the death registry. So the fetal death registry will go live in June, and then the next is birth certificates and marriage. And then we will be electronic. The publication of the Comprehensive Civil Registrations and Vital Stats from 1998 to 2003 with support from the Office of Epidemiology. Epidemiology is ongoing. And in the Bureau of Alternative Medicine, the implementation of a comprehensive childhood lead poisoning prevention plan will be implemented by September of this year. Next slide, please. The Bureau of Communicable Disease Control, again, some of their highlighted initiatives. We continue to do responses for influenza that's ongoing. Our proposed amendment of law governing Guam Immunization Registry is pending legislative action. And the pertussis immunization outreach from May to June of this year continues. We just had a immunization outreach yesterday in the village of Barragata. The Bureau of Primary Care Services, again, your CHC, a new electronic health record will go live. Our target date is August of this year. Telehealth development initiative to improve access to healthcare across Guam is being worked on. Integrated primary care and behavioral health service continue to be worked on. And operational readiness for CHC autonomy continues to be worked on. And that concludes the largest division of the Department of Public Health. The second largest division we will proceed to is the Division of Public Welfare. It's the second largest division, but it's the division that's asking you the most money. So we will proceed with topics of interest. Next slide, please. What is the financial impact of the One Big Beautiful Bill Act for the department or the division? For FY27 specifically, this was shared last year that it was upcoming. Time flies and we're here today. For FY27, SNAP, FNS, administrative costs will be covered by the federal government at 25% only, increasing the local share to 75%, which is approximately 1.7 million increase. So we appreciate FNS's funding for SNAP, but more and more, like lots of states, the burden is put on the local government to cost share that. So an approximately increase is the impact of 1.7 million. What is the status of implementing the SNAP able-bodied adults with dependents or ABOD waiver changes. This is an immediate impact that we're going to realize in 2 weeks. DPW is prepared to fully to be compliant with FNS, which is the funder of SNAP, related to the ABOD waiver that takes into effect June of this year. We put out the press release in January. We wrote to all able bodies, impacted population of SNAP, and just for statistical data points, 19,277 are identified in SNAP as able bodies. The number of clients that will drop off from SNAP because of this implementation federal law, 6,956. The number of clients that will comply with the change, 12,321. They either complied with the change, which required 20 hours of volunteer or paid work, proof a week, 80 hours a month, or they got an exemption from their doctor. So it's a combination of exemption as well as actually meeting the work requirement proofing. That's 12,321. The average dollar figure per ABOD household financial impact that will be removed from the economy is $3,053,685. That's $439 times 6,956 able bodies that will no longer be able to avail of SNAP. Concerning, because the question is, where are they going to get their food help? And that's where the Division of Homelessness and Poverty Prevention, our food commodities, and our soup kitchen can assist. But I just wanted, because that's a big impact for public welfare, the Division of Public Welfare. Back to the third item on topics of interest. How is DPW improving responsiveness and communication with clients? That was a big topic because 2 years ago when I came, the public relations concerns of the department seemed to be centered specifically in the Division of Public Welfare, mostly because of SNAP and Medicaid clients feeling that they're not served or communicated in a timely manner. And I just want to share that we are completely focused in that. As of April of this year, there are no email, backlog is 0. Inquiries are responded within 2 days. We continue to have a single line that's answered by a warm body instead of a hunting and just ringing and ringing, which is a previous complaint. And again, emails are being answered in a timely manner within 2 days. When will disaster SNAP be available to the public because of Sinlaco? That is a question that comes up all the time. And DSNAP, I just want to reassure everyone that we are planning to execute DSNAP when the declaration for the major disaster declaration is approved by the President and FNS approves the waiver. So we're not waiting for that to prepare. We are preparing now. because we do have experience in Mawar, and I do recall in Mawar, I was at behavioral health at the time, there was lines and frustrations and things like that, so we're really trying to build on that experience and make sure that when it does roll out, that the public is less frustrated, less waiting in line. One of the things that we're looking at is an online application that will reduce the waiting in the sun and the waiting in the line and things like that nature. So, next slide, please. Currently, today is the last day for the food loss waiver. The food loss waiver was the second disaster SNAP program that we rolled out in a month because it's been just a month since Sinlaku hit our island. Food loss waiver are for those who received 63% of their SNAP replacement in April of 24, just a week after the typhoon hit our island, and feel that they really lost more food than 63%. So they're able to apply for a food waiver that we verify, and if we could see that they spent most of their money or more than 63% prior to the storm, then they're able to get up to 37%, which adds up to 100%. So today is the last day. We rolled that out this week. I just want a big shout out to the team that's working the food loss affidavit program because it's running well. I think I provided you some stats as of yesterday. The email inquiries or the email applications and inquiries of affidavit received was 600. This is what I mean by we implemented an online application or affidavit in this case so that people don't have to waste gas. With gas prices, we think of these things. We're very cognizant of the price of gas. We don't want people waiting in line unnecessarily. So we launched an online affidavit that yielded 600 affidavits and emails. That's 600 people less waiting in line or having to drive. So really big shout out to the division and the SNAP folks for making sure that that is rolled out. That did not happen in Mawar. And so we learned from our experiences. We did have an influx of people the last 2 days, Monday and Tuesday. I don't have the numbers from last night. It's probably in my email inbox. But 640 did come to Castle Mall. 402 were processed, 168 were approved, 230 were denied, 4 were pending. The denial was basically mostly because they did not qualify for the affidavit to begin with, but they put it in anyway. So again, the criteria for the affidavit is you must have received your 63% in the beginning for the automatic food loss replacement. So a lot of these denials are folks who are maybe mistaked it for DSNAP, maybe, or became SNAP recipients after the storm, which means they didn't qualify for the 63% automatic replacement, which means they don't qualify for the food waiver for the difference. Okay. Today is the last day for the food loss waiver affidavit to be submitted, and then we will close out that disaster project. Our provider and pharmacy payments current As of April, 100% of the clean claims have been paid to medical and pharmacy providers. So we are current. What is the Medicaid cap for fiscal year 27? I bring this here because it's our ask, right? We talked about this, Mr. Chairman. After the budget was submitted, we received from Medicaid or CMS an increase. And to date, we anticipate $150,980,000, which is a $5.5 million increase from last year. We received the notice April 22nd, which requires a 17% match because we are at a match rate of 83.17 of an additional 918. And just wanted to share that. I know I shared it with the chairman earlier. Next slide, please. The status of summer EBT. You know, where graduation's happening, it's summer, school's out. DPW anticipates launching summer EBT. That's summer SNAP for kids who traditionally get meals in the schools because school's out. They will get it through their EBT card. And we plan to roll this out next month, June and July. But we are waiting for the grant award, which is 100% federally funded. So hopefully we'll get that soon, and we will roll that out next month. What is the status of the Integrated Eligibility Enrollment System procurement? This is the big effort of modernization that I've been talking about last year. It's currently the IE&E, or the Eligibility Enrollment System, is under review from CMS, FNS, the Guam, our Attorney General, and we do anticipate an advertisement out of fall of this year. But I do have to say that CMS has already cleared it. FNS is really in review still, and we are waiting as well as the finishing review of the Attorney General's office before we can proceed in the procurement phase of advertising it out. What is the actions that this division has taken to strengthen program integrity and audit readiness? Again, very important, fraud, waste, and abuse is something that nobody should tolerate. We are literally establishing a dedicated program integrity unit focused on fraud, waste, and abuse. It will strengthen audit and oversight functions, and it will expand data analytics and monitoring to improve visibility into the program activities. We do not currently have a program integrity unit, and we are establishing it right now. Next slide, please. Okay, so we're at the budget. Oh, what is this? So, I'm sorry, Senators, give me a minute. Sorry, my slide. I can't see very far, and my DPW. Sorry, I have double. Anyway, the slide is before you. If I can. Sorry, my copy of my binder slide is kind of messed up. I don't know. Here we go. Yes, here we go. Now I can see what you see. Sorry. For the Division of Public Welfare, we're looking at $44,166,620. And an ask, a huge ask. As I mentioned, it's not the largest division, but it's the largest money ask division of $188,465,584 of matching federal grant in aid. A total budget request of $232,632,203. You do have a supplemental match request of 918 senators, Mr. Chairman. This is the additional Medicaid cap. I do have a requested, something we did not talk about, and I can give you a breakdown of this, a supplemental match on all our APDs. APDs are advanced planning documents, and all based on our modernization effort, which we receive is part of the $39 million last year that I said that I received from CMS for modernization, but there is a match that is required. And this is the APDs that were not received on time and for the budget submission. So this is a supplemental ask for the match for the APDs. So if you see in the total request for this division, it's totaling $235,420,870 from the original budget request of $232,632,203.
Director, just
Yes.
so that I just want my colleagues to know,
Yes.
before we go into the question and answer, I will read out the OFB adjusted general fund
Yes.
request.
Yes.
Because the numbers can become overwhelming, but
Yes.
most of this is federal.
I know.
So before I start questions, so that they'll have a full, accurate representation, I will go through by the subject category,
Yes.
and I will show the total change in the general fund ask. Please proceed.
Thank you. So just looking at public welfare in general, on the general fund side, it looks like only 4%, but really it's because our federal dollars pay for most of our personnel. If you look at the utilization in the bottom, meaning our burn rate, how we're spending this fiscal year's dollars that was given to us, we're at 60%. Of course, because we're pushing out SNAP, we're pushing out Medicaid. I mean, we're paying providers, we're paying staff. So we're at a burn rate, a good burn rate of 60%. Okay? Next slide, please. This is just an overview for, I don't want to read this. This is for your review, and it's just what the Division of Public Welfare is all about, our mission. Next slide. When we talk about impact in the community, here's our client impact. We serve 41,865 Medicaid clients, 119 MIP clients, 36,390 SNAP clients, and 1,562 cash clients. Next slide, please. This is the division's performance in recovery after Typhoon Sinlaku. Again, in the SNAP arena, we executed AMR benefits, which is the automatic mass replacement, on April 24th. And that, I just want to say, FNS and I, we were on the phone through the storm. In one day, we submitted. And the next day, they approved it, and in a week's time after the storm, it was in our SNAP recipient's EBT card. What does that do? It circulated $7 million in the economy. We received, again, SNAP food loss waiver. That is an initiative for the disaster of Sinlaku. Again, today's the last day to receive those affidavits, and we continue to process. The third bullet, and I'm proud to say, we worked very closely with CMS, and we approved for the first time an emergency advanced planning document, which is additional dollars, which will provide $1.5 million in federal funds. That has been approved because of Sinlaku. That requires $385,000 in local match. However, the local match has been approved by the governor's office to come out from the Sinlaku Emergency Appropriation Fund that the legislature provided. So we're not asking for it here in this budget request. Pharmacies were able to reopen promptly and process prescription needs, all due because of the pharmacy benefits manager that went live September of last year. DPW is leveraging many emergency waivers for the next 60 days. We are in a public health emergency that was declared by RFK Jr. and is good for 60 days. And we have a bunch of waivers, automatic emergency waivers, that will apply to the provider as well as the beneficiary. And that, we can give you a whole list, because it's quite lengthy, if you like to see it. But know that in the next, we're a month out after Sinlaku, we have another month. Everything can be retroed back to April 12th. So we're going to see providers getting some increases and flexibility, as well as our clients when it comes to coverage. So what does that mean maybe in the health arena? For those who walked in to GMH, for example, right now from April 12th, 60 days out, which is a month out from now, will be covered by Medicaid if they don't have insurance. So we do our little part to try to help the hospital with their unfunded or cash clients. Again, if you want the list, we can give it to you. It's quite lengthy. Next slide, please. Oh, I'm sorry. Oh, yeah. And of course, the pending is the DSNAP, but we are preparing for that. Next slide. This is our accomplishments of the Division of Public Welfare. And you can read it at your leisure, but I want to highlight some things that I bolded. In the processing, we improved the SNAP application processing timeliness from 36%, went up to 43%, now 79% since January of 2025. So since January 2025, we've been working really hard to make sure that SNAP applications are done in a timely manner. We strengthened communications, customer communication practices. I mentioned before a centralized email and phone line and no backlog, so that's been helpful. And something that we're very proud of, unfortunately, we've recovered $163,000 in SNAP and cash assistant program funds in FY26 through internal investigation auditing. Next slide. More accomplishments from the division. Implemented, of course, pharmacy benefit manager system in September of 2025. Estimated annual savings of 15%. Estimated Medicare Part D savings, $540,000. Why is that important? We collaborated with CMS, and those who are dual eligible for pharmacy coverage are now moved over to Medicare and no longer in the Medicaid. Medicaid is no longer paying for that. Medicare is now paying for that. A first for Guam, something I'm very proud of. Guam we are not part of the national rebate for medication, but through our PBM, for the first time, we have generated 1.7 million in program rebates or program income, expanding the cap that much more. In other words, it needs to go back, the rebates go back to the program, and so it's almost like we have an artificial extension of our cap of 1.7 million. We anticipate at the end of this fiscal year to be at 2.5 million. So this is a first for Guam, taking advantage of rebates and kind of extending our cap out. Improving access to affordable medication on and off island. Our PBM is negotiating for the first time general off-island pharmacies out there like CVS, Walgreens, those that you find in the States, so that our local people that are off-island that go and refill because they're there for medical work can get a discounted rate. And of course, I mentioned earlier our request for proposal for our modernization of our eligibility and enrollment system. And that's still pending FNS AG's review. CMS review, we were informed, is completed and they're fine with it. We met CMS. We are the third U.S. territory to achieve compliance to maximize program integrity. It's through the TEMS's reporting requirement for Medicaid. Next slide. Can we go back a slide? Yeah. And these are all the lists of all the modernization initiatives that I'm talking about, all the APDs are supporting. Lots of it is technical, but we tried to put it in as, even with me in the terms in CMS. But you can review that at your leisure, but know that these are all the modernization initiatives that this division is working on and supported by APDs. That's APDs are federal dollars that do not impact our Medicaid cap. It doesn't come out of the cap. It's a separate fund, but there is a match. Okay, and we are done with the Division of Public Welfare. We'll move forward to the Division of Homelessness and Poverty Prevention. Next slide, please. This slide shows DHAP and its transfer from the Office of the Governor through an executive order, creating a division of public health that ties into our mandate of missioning and helping the homeless, and this happened last year of 2025. Next slide, please. This is a slide that shows what's the status of all the shelters and the housing that DHAP is overseeing, assisting with case management. We have the Bradley Apartments in Antigua, the Tamuning Drop-In Facility, or Iriarte Street, the Bed of Night, Rancare Residence. We call it Rancare because it's the apartments behind Rancare building. We don't have an official name yet, so we're calling it Rancare Residence. Of course, the Ministry of Homelessness Soup Kitchen, we are in the middle of the soup kitchen is transferring to public health, and DHAP's drop-in center is located there. It's kind of like everybody, the homeless goes to the drop-in, Camerlin Caradot in Anigua. That's the Ministry of Homeless Soup Kitchen, or better known as Camerlin Caradot, the soup kitchen that feeds nightly. DHAP now is a drop-in center during the day. And Guma San Jose Deredo. So there's a lot of information there, estimated opening date, when it was acquired and who acquired it, the details of the unit, the funding sources, and the population it serves. Next slide, please. This is just a slide of an overview of the mission of DHAP and all the services they provide. Village outreach, case management, emergency food assistance, or the TFAP food commodity distribution is under them. Domestic violence program is under them. Safe House is under them. And the Guam ID for Homeless program, created by Public Law 3532, is under them. Next slide, please, for the overview. Continuing. More continued services that they do. They help with storage of essential belongings with the street homeless, assistance in obtaining documents, assistance with public health benefits. They help navigate the public health programs, SNAP, Medicaid, etc. Emergency shelter coordination and shelter referrals to Guam Homeless Coalition partners, housing stability services and eviction mitigation, and they have formal partnerships established. 5, of course, the largest is the Guam Homeless Coalition, which we are a part of, the Division of Rev and Tax, or Department of Rev and Tax, the Division of Public Welfare within Public Health, the Mayor's Council of Guam, and the Guam Homeland Security. Next slide, please. Okay, we're at the budget. For DHAP, our overall ask is $1,108,564. Our operational breakdown, it is about 48% personnel, 52 operational. The 1 million senators include the 500,000 that was separated out in a section. And our burn rate right now is at 17%, but this is as of March. The current burn rate, I will get that to you, but we have an MOU that's being executed right now as we speak at 298,000. That's going to the Homeless Coalition, but it's in the process, so it's not actually executed yet, so I did not put it down as a true burn rate. But that burn rate should go up as soon as that dollars are transferred over to the Guam Homeless Coalition, which is one of our biggest partners. Okay, next slide, please. This is the slide of the breakdown of the 500,000 in the section, the 500,000 that is inclusive of the 1 million ask, okay, last year. Next slide, please. Typhoon Sinlaku response, it's important that I say this because this is one of the divisions with public health, with immunization, and with DPW that really came out quickly with response to Typhoon Sinlaku. They worked with DOE in coordinating shelter. In other words, right out there while we were bunkering down, my staff was out there coordinating getting homelessness into the DOE shelters during the typhoon. It's a process. Many of them don't want to leave, but we got them into shelter because we did not know how hard it's going, and we didn't want them out in the streets. We provided food and emergency shelter for those who did not bring sheltering supplies in the shelter. We coordinated shelter transportation with the village mayors, Public Works, Guam Regional Mass Transit, and law enforcement, just to get our homeless off the streets during the storm. You might have heard of all the food distribution. That all was initiated through DHAP with the help of everyone in the department trying to help pass out food. And that was through the TFAP program. We had various locations, and there's a breakdown coming up. Assisted American Red Cross with the Tier 2 shelter with case management at Jigo Gym, and arranged for shelter for vulnerable and elderly individuals at the shelter closure of the Tier 2 shelter. Next slide, please. This is the breakdown of the number of food commodities and where we were able to meet the clients in need. Really, 3,040 households, or an estimated 11,000 plus individuals, received food commodity bags from DHAP in these various dates and location distribution points. Each food commodity bag is an estimated retail of $50 a bag. Next slide, please. Accomplishments. This is an accomplishment that we're very proud of. As the newest division of the department, it was important that they establish a strategic framework in which they run their department. So I'm happy to report that they developed and finalized a DHAP strategic plan and roadmap. The funding roadmap will be completed by this year, but their strategic plan is completed, and that's a big task in itself. What did they do? They met with stakeholders. They brought stakeholders from the community, all the partners that they naturally work with. We held meetings of how are we going to address the homelessness issues that's honestly predominantly in Agana, not just in Agana, but I'm sure just very nearby, across the street here. How do we address homelessness? How do we get vulnerable population like the homelessness into housing, or the assistance, the social assistance that they need to be ready, to get ready to go into housing? Because some of them are not ready to go into housing, or the medical or emotional care they need to ready themselves to get into housing. So that was all captured in their strategic plan. And that, I'm very pleased that that happened. Next slide, please. Initiatives, meaning what are they working on to date? These are some of the initiatives. Can we go back? There are 2 pages of initiatives, senators, that you can read and see. Initiatives meaning they're working on it. Under the Safe Shelter Assistance for Elderly Housing, Ministry of Homeless Feeding, what DHAP did with the funding that the senators gave of $500,000, the Ministry of Homeless Feeding Support that is run by the Catholic ministry ran through volunteer families that wholeheartedly give and donate every night. But not every night, not every 365 day a year is covered. We covered the gap with the funding that was received, making the entire feeding for the entire year available. And of course, THAP is the Emergency Food Program, and that is the food warehouse that used to be warehouse at DOE, but now with the Division of Homelessness and Poverty Prevention. And that's where we get our food bags and food commodities that we passed out during disasters, and on a regular basis, I should say, in partnership with the mayors. Next slide, please. Ongoing initiatives, Bradley Apartments, Rancare Residence, the DV Harbor Grant Project, the Bed and Night Drop-In Center, and of course, they're very involved with the pit count that most of you are involved in as well. To date, officially, the current unhoused count, point to date, that occurred in January of this year is looking at 849, but that has yet to be confirmed by HUD. But that is the count that we gave HUD for this year. 849 individuals living on the streets. Or I should say, living on the streets or living in substandard housing. And I believe that rounds up the Division of Homelessness and Poverty Prevention. The Division of Environmental Health. I think in this division it's always safety, food safety, and school inspections. And I'm happy to report that our inspections are on track with DOE. We have a closer collaboration with DOE. The times of the past of worries of whether the schools are going to be open because the inspections did not happen on time is a time of the past. So I'm happy to report that. And there's, next slide, please. I'm sorry. Yeah. So school inspection slide is right there on slide 43. And you can, the detailed information is there for your review. But what's important is that we are ready for this school year and on time and on track. Next slide, please. The Division of Environmental Health. How are sanitation inspections going? Again, I think one of the biggest highlights is that we do inspect many different facilities. Of course, restaurants, food establishments, cosmetology, schools, barracks, dry cleaners. So the sanitation inspections are ongoing. You can see the detail. The good news is that we have not had an outbreak, food outbreak, in years. Next slide, please. This shows how often with the minimal staff we have, how often we inspect the various establishments required by law. Next slide, please. The budget for environmental health. The budget for environmental health requests $835,031. Also from special fund, the Environmental Health Fund, $1.812482 million. From the Special Fund of Sanitary Inspection Revolving Fund, $510,221 for a total of $3,157,734. If you look at the operations breakdown, 97% is personnel, because really that's what they do. We need people to go out and inspect. inspects schools, inspects establishments, food establishments, etc. And you have a burn rate of 27% at this point. You have, I want to highlight there's vacant funding, requests of 13. Environmental health is one of those divisions that just has a very difficult time in recruiting. We have a continuous open recruitment in the Department of Administration. So those of you who find environmental health interesting, you might want to take a look at those ongoing recruitments that is year-round. We continue to work with schools to bring the interest to our young folks with University of Guam and GCC, but there is a struggle in obtaining folks who want to work as inspectors. Next slide, please. The Division of Environmental Health Overview. Again, health inspection, this is their mission statement. They oversee island-wide environmental health programs and activities in 7 major functions: health and sanitation, food safety, next slide please, consumer commodities inspection, mosquito surveillance and control, counter service, issuance of 30,000 regulatory permits, certificates and registrations, radiological health, and education and awareness to the public. Next slide, please. Next slide. As of April 30th, these are some of the highlighted accomplishments. They've issued 21,000 health certificates, 1,500 plus sanitary permits, 322 drug registrations. They've achieved 90% survey respondents rated customer service as excellent. Health sanitation responded to every public complaint. There was about 86 anonymous complaints that they looked into. Business License and Permit Center up at the Department of Public Works. Permitting Center, they expanded their services since August of 2024. They provided 1,500 plus consultations, and they issued 735 business clearances at one stop. Customer Commodities Program, we have a great partnership with FDA, resulting in improved identification of violative commodities that are being imported at the airport or in the ports. 104 detentions involved nearly 162 pieces of articles that are questionable and have to be, a decision has to be made. Whether or not it's safe to have enter our island. Next slide, please. Continued accomplishments. Food safety program. We trained nearly 4,412 food handlers as of April 31st. Again, as I mentioned earlier, we have no confirmed foodborne illness outbreak in the last 11 years. That is important. Now, not to say that people don't get sick after they eat, but that is in between and never foodborne illness, an outbreak that we can declare an outbreak because of unsanitary establishments. So thank you, DEH, for that. And thank you, participating restaurants who keep your restaurants clean for our people to be able to eat there. Thank you so much. Last but not least, accomplishments of mosquito surveillance control program. All imported and locally transmitted mosquito-borne disease cases are successfully contained. And we do weekly trapping and identification of adult mosquitoes from 10 sites. Continuing, next slide please. We continue to collaborate with GDOE for annual inspections. As I mentioned, we have a strong relationship with DOE. We have a very strong relationship with FDA for the commodities. And DEH helps lead Micronesia and the US API in mosquito management. Our division chair, Tom Nadeau, chairs the Pacific Vector Network, which encompasses 22 Pacific Island countries and territories, as well as chairs the Pacific Island Vector Management Control, which involves our Micronesian islands. So we are seen as the leaders, and we take this responsibility serious, and we share what we know with our island brothers and sisters, not just in our region, but in the greater Pacific. Next slide, please. For the Division of Environmental Health, some of the major initiatives they're working on. We do have the DEH main facility identified in Deridell, right next to the mosquito lab. Architectural and engineering design is completed, but we are looking for additional funding for the construction. And so we're looking at hopefully getting some help from the Congressman's office. And so the architectural and engineering design is completed, but looking for funding for construction. It's always the issue, construction. Governor's Environmental Health Collaborative Team continue to meet to develop educational pathways to DEH employment. I spoke earlier about how difficult and the interests of our people of Guam to get into this field. We have ongoing recruitments that is continuous. There's no, if you look at DOA announcements any time of the year, DEH positions are there, waiting for people of interest to please join the team. We work with GCC, planning an associate's degree in environmental technology, and again, working with the University of Guam, developing an environmental health science curriculum for a bachelor's degree. But that is really the biggest, I believe, the biggest struggle that we have in the Division of Environmental Health is the limited number of employees, and really starting to create the interest at a young age in the high schools so folks can get into this arena. Next slide, please. We are still seeking the adoption of the revised rules and regulations for school building, combined child care, and intergenerational daycare centers and health certificates, and we are collecting and working on the economic impact statements for these rules and regulations. We are working on the implementation of health certificate cosmetic sanitation training course for employees of cosmetic establishments, and that's targeted for this summer. And we are working on initiating actions for the adoption of the 2022 FDA Model Food Code to replace the existing code via our Guam Food Safety Advisory-led effort. And that target of adoption is the end of next year. So those are some ongoing initiatives that the division is working on, and that rounds up the Division of Environmental Health. Two more divisions, senators. Division of Children's Wellness. Thank you. Topics of interest. What can families expect when they apply or renew for child care assistance? Effective this year in January, the Bureau has reinstated its pre-pandemic status standard child care policy for families who apply or renew their child care assistance applications. So, during the pandemic and up to December 31st of last year, we paid for all overages and co-payments. As of January of this year, we no longer pay for tuition overages and co-payments. The only payments we will pay is paid based on the Child Care Development Fund maximum rate. So what does that mean? That means if a child care center charges $1,000 per child, or for a child of a young age, under 5, and we only pay $700, the family has to pay the difference. And this is not new. This is just pre-pandemic, going back to the pre-pandemic standard. Next slide, please. What can delay child care subsidy payments? One of the biggest delay recently is the timely federal allotments that have come down. In the past, we were able to predict when our allotments were coming from our federal funders. Lately, we are now, senators, in Q3, and we have not received Q3. We are midway Q3. We just recently received Q2. So one of the biggest concerns, and unfortunately, something that we have no control over, is the timing of federal allotments. Again, Q3, even though we're already in the Q3, we haven't received it. That would be the only reason why we're holding off on paying. Our foster maintenance payments are up to date as of March of 2026. Next slide, please. What is the status of our contracted group homes? I've listed the program and the contract updates for your review. IGM, which is our Guåhan, our public health run child's shelter, unfortunately has been in the RFP process since 2024. And we continue to follow up. The latest follow-up was last week, where we had to resubmit to the AG's office a copy of it, because despite reviews previously, as you can see in the dates, they could not locate it. And I think what's happening is, as legal counsel who work at the AG's office, lawyers who work at the AG's office, probably leave the AG's office. Maybe they pack up and they take the copies with them. So that's why it's important that our staff constantly follow up, because in case they need a new copy, we're able to give it to them. But I know that the AG's office is reviewing it. It's just been quite a long time. So why is that concerning? Because we really don't want to be in the service side. The department wants to monitor, push this out to nonprofit organizations that are better equipped and understand shelter management. But until then, we are running IGM, our shelter. Alley 1 and 2, the procurement process is in progress. Guam San Jose, again, the procurement process is in progress. And Alley 2, you see an update there. All our contract updates are there for your review. Next slide, please. Division of Children's Wellness Budget Requests. We're requesting $13,088,117. If you look at our operational cost breakdown, 25% is personnel, 75% is payments or operations. We have a good burn rate of 60% well into this fiscal year. Next slide, please. The Division of Children's Wellness. This is a quick overview of our mission and the two bureaus under that division. Very clear: Child Protective Services, foster care under BOSA, Bureau of Child Care Services, take care of child care assistance and child care licensing. Next slide, please. Next slide, please. Accomplishments. Just gave you the data, how many people we serve, how many children we serve in the Division of Children's Wellness. I want to highlight on the right the number of children in CPS custody, 689. That's the breakdown where they're located. We're up to date in all the referrals. We do not have a backlog in referrals. So these are our accomplishments and data points. Number of families receiving child care subsidy, 2,097. Number of children enrolled in subsidy program, 3,137. Our monthly average cost of child subsidy is 1.9, that's monthly. The number of CCDF licensed child care centers to date is 69. The number of licensed exempt after-school program child care providers, that's like our back after-school programs at the mayor's office, DYA centers, 25. The number of licensed exempt relative and in-home caregiving providers, 79. A lot of our kids, you know, the next best thing is having them live with relatives that they are familiar with. And then, of course, the BOSA breakdown to the right. Something that you can look at. Next slide, please. Some of the initiatives that they're currently working on. Deploying a workforce needs assessment to child care providers for targeted training. Increase the number of high-quality child care programs in Guam. We're working on contracting services, as I mentioned earlier, of the shelters, children's shelters. We're trying to secure Title IV-E, federal reimbursement for foster care and adoption. We're working on development of a workforce registry to track provider credentials and support compliance with licensing for the CCDF requirements. And we're developing a quality improvement system to enhance child care quality. Next slide, please. And that rounds up the Division of Children's Wellness. And last, but definitely not least, is our Division of Senior Citizens. Some topics of interest, of course, is our 2026 Senior Center operation. Just so everyone and the senators know, Public Health has fully funded the Senior Center operation that we partner with the Mayor's Council of Guam with an approved budget of $1.476087. As of April of last year, their expenditure rate is at 33%. How many home-delivered meals were served by this division's contract? As of March, 240,526 meals have been served to homebound clients. The current home delivered meals program clients served is 1,395. Why is there an increase, you might ask, in the contractual services from $6 million in FY26 to $800,407,862, an increase of 21% in FY27 ask? And it's due to the projected operational costs of contracted services compliance with service contracts, and that's the natural compliance of food costs going up and labor costs. Another hot topic of interest for the Division of Senior Citizens: does the Division of Senior Citizens pay for family caregivers? In this time when so many of our elderly, our culture of inafamalik and keeping our family and our elderly at home, we get inundated for the number of people who are asking to please find caregiving services for their elderly loved ones who are at home. Unfortunately, our divisions do not, this is not allowable costs in our federal funding. However, DSID has an existing family caregiver program that we often refer clients to who are looking for that kind of in-care home service. Does the Division of Senior Citizens have a wait list? Yes, we do. In home care service, wait list is 134 as of March. The contracted home service is servicing 387 clients from the maximum amount of 400 clients. Medicaid program exploring how Medicaid coverage can pay for this service so that we can remove the wait list. Again, the wait list is there based on our contractors' ability to recruit to execute our contract with them, and thus the wait list of 134. Next slide, please. The Division of Senior Citizens is asking for $10,481,498. A federal match, there's only two divisions that ask for match, and that's the Division of Public Welfare as well as the Division of Senior Citizens. And they are asking for a federal match of $3,825,580 for a total number of requests of 14,307. $14,307,078. If you look at the operational cost breakdown, you might say 9%. It's the smallest division. Most of its work and is contracted out, and that's why you see a very high 91% in operations. Our burn rate is very high. We're at 91%. We will make it whole for the next five months, or whatever is left of the fiscal year. Whatever is needed by the division to continue its services to September, we will make it whole and look within our department. Next slide, please. The Division of Senior Citizens overview, its mission statement, and the different support services it provides. Next slide, please. Its accomplishments given to you in data points for your review. Next slide, please. More accomplishments through data and how we touch our senior citizens. Next slide, please. Initiatives, what they're working on. This is a great initiative that they're working on. It's starting, and it's the Veterans Directed Care. The division is exploring partnership with the Veterans Administration and coordinating veterans self-directed care services on island. So our veterans will get some very specific funding and specific care through this initiative. And last but not least, today, May is Senior Citizens Month. You all should have received a list of scheduled events. We will make sure that you all receive again the scheduled events, but we would like to especially invite you all to the proclamation signing on May 19th at the Sinahanya Mayor's Office for the proclamation signing of the division of Senior Citizens Month. And there's a frail elderly mass on the 22nd of May. Of course, the legislature is hosting its reception with the Oversight Chair, Senator Shelley Calvo, on May 27th. The Governor's Conference on Aging is June 3rd. Our centenarian celebration is June 9th. And Guåhan Senior Games, which is Senior Games, is on August 28th. So a lot of them, I know May is a Senior Citizens Month, but it was pushed back because of the storm. So unfortunately, we're not declaring a month with a proclamation in the beginning of the month like we normally do. But please join us. This will be sent to you. And Senators, that concludes. Dangdangkluna Sidzuismasi for your time and attention of the department's request for FY27 budget.
Sidzuismasi, Director Ariola, for that very detailed presentation. To my colleagues, I direct you to the budget digest that has been provided for you this morning.
Oh, yeah.
The adjusted requested levels under the fiscal year 27 agency's request general fund. You will find the number currently on the sheet, 77,919,824. That will increase to 80,708,491. And under the variance of the 2027 agency request versus 2026 authorized level, that number will change from 5,588,860 up to 8,377,527. And so, just to be clear once again, in the grand total, which will change, of the over $273 million, 80 million is the general fund request, as public health actually is generously funded by federal government for various programs that the director has just enumerated throughout her presentation. So I will now move to, if the health chair wants to go first or last, I will defer to your decision. Okay, the health chair, Senator Sabrina Salas-Montanani, you have 5 minutes. And I just want to reiterate once again, I thank the health chair for having several oversight hearings under her leadership as the health chair, as well as this very detailed presentation. I have been very strict to our budget meetings to discuss the budget. And thank you for coming forward and having the pre-budget meeting with us so that we could understand exactly what your request was from the agency level. Also, your request was in the governor's submittal back in January, so we had plenty of time to review it. And now we'll talk about the numbers, and I will go to the Oversight Chair. Senator Montanani, you're recognized.
Thank you, Mr. Chair, and thank you, Public Health, for your very thorough presentation. I do have another meeting that I have to go to, so I'll keep my questions brief. I wanted to question first about the staffing pattern, especially this Division of General Administration, and I noticed that the Director's Office is under that particular division. Can you explain why and how long has this division been in place?
The Division of General Administration?
Yeah, I noticed that the staffing pattern that your office is under the DGA.
How long has the division's been
yeah,
in existence?
Yeah,
From the beginning?
since the beginning of public health. It's been okay. And so I noticed that there's 23 positions that are funded, but there's 7 vacant that you need to fill. And so you have some very important offices under this division, to include Financial Management Service, Office of Grants Management, Procurement Management Office, Performance Improvement Management Office, Management and Support Services. And so I'm just kind of concerned because when I looked at the fiscal year 24 audit findings, there were, I guess, public health was the second in terms of question costs. And I know that you guys had a response, but are all these offices still in existence under this division? Do you still have an Office of Grant Management, a Procurement Management office? Are all these still, because I'm hearing that some of these offices don't exist anymore, or?
We do. It might be an office of one person handling it, but there is the activity of managing. We know currently grant managements right now is vacant. It's important with the department being the largest agency that receives a great number of grants, over 100 grants in the department, but it's just finding the right person, the recruitment for that grant management. That is a difficult task. A lot of the expert grant managers out there are running nonprofit organizations, and so that, I have to say, has been the hardest recruitment of that vacancy.
How long is this, is it a position or an entire office? Like how many employees?
Well, the goal is to have an office, several people, but we need to start with at least one right now. Somebody who's going to oversee. Right now, all the grants are all over the 7 divisions. And the program staff are, of course, running and executing the activities of those grants. But to ensure of compliance, to ensure that we meet the federal reporting, making sure that we're able to say that we're in good standing to the grants managers or the grants funders, it's important to centralize the grants reporting system in a grants management. But I have, I don't know if you want to. I can answer. Yeah. If I can ask Ken Blas, who's the chief of that division, to expand.
Okay.
So, Senator, with regards to the Grants Management Office, it was a couple years ago fully staffed with a couple individuals, but they have since retired. So we've been having difficulty with recruiting for those positions. So what we did was a lot of the work has migrated to other offices within the division who carry that load, such as the Public Health Infrastructure grant staff. So, as well as the individual divisions oversee their own grants. But
So-
we are trying to stand these offices up. It's just that we're tied to, recruitment.
Okay, you said offices. So what other offices are we talking about? Office of Grant Management, do you have vacancies there? What else?
The other position mentioned, I forgot,
There's management, there's MSS, there's, I don't have a list in front.
Management and Support Services,
Yes.
vacancies there?
Yeah, well, right now there's really no vacancy because they're not funded. But it's our hope that we can move some of the people from the other offices. Once, like from the FIG office, once that grant expires, then we will move them over to these offices.
Performance Improvement Management Office?
Yeah, that one we have yet to stand up, but we're in the process of trying.
Procurement management office.
We're in the process of trying to stand up a procurement office.
And so you don't have anybody running grant management, it's just filtered out into
Yes,
the
to
different
various-
divisions?
Yes.
Divisions that are carrying
as
the
well
program.
As well as within our own division, we have people under the FIG grant who are
So you don't
assisting.
have one office overseeing how all of this is being managed?
It's-
Like your grants are just spread out, there's not one
Yes,
central?
there is. It's still funneled under this division, under Division of General Administration. So we oversee the federal programs inventory, everything that happens with all the grants funnels through our offices.
And who is overseeing it? You?
Yes.
You're the only. So let's just talk about then this whole child care, the issues that I think it's the reimbursements, because I get the phone calls. There was a bill that was introduced to fund $6 million to help with paying out these reimbursements. But I'm hearing in your presentation that that's no longer needed. I mean, what's changed?
What's changed is as
The
I
allotment
mentioned
was
earlier,
released?
is the funding being received. We
So
finally received the funding, so we were able to pay the invoices. That's the only reason why we hold any CCD funding. As I mentioned, we are already in the third quarter, and we haven't even received our third quarter allotment from the federal funder.
And is the delay in the release of these allotments from the federal government, is it an internal issue or an external issue? Meaning that, is it because you don't have this Office of Grant Management, you don't have the staff for procurement management?
No, ma'am.
Is it a capacity issue with the Department of Public Health?
No, not at all. We just can't pay invoices that are funded 100% by federal funding that has not been received by the government of Guam yet. So once we receive the money, we process it out. As soon as we receive the money, I think, when did we receive it? Quarter 2 in April. We paid out, we caught up. Now, unfortunately, there will be a delay unless we get the money for third quarter anytime soon, because we are in the middle of the third quarter and we haven't received the federal funds for third quarter yet. So yes, unfortunately, we're going to feel it if we don't receive it.
Is this
federal
just an
dollars.
issue isolated to the government of Guam, or other jurisdictions experiencing this same
every
problem with delayed
jurisdiction in the
allotments?
nation that is funded by CCDF funding. I'm assuming that, and I know because I'm speaking to the chief, Heidi Kanata, the first thing I asked is exactly that. Is it just us? Are we, like, is something going on? Like, I don't know. And she reached out to her network of states, and it's everyone who's experiencing delays. The delays in the federal government today that never was experienced in the past is also because the current Trump administration has a lot of scrutiny about defend the spend. So defend the spend is really causing, my interpretation is that they have a much more scrutiny on their spending, so their allotments are being released slower. That's, you've heard of defend the spend. They are being asked to look at the federal level to relook, is it really defendable? Are the states and territories, in our case, really justifying the need? And I believe that maybe that's a little bit of it, and maybe federal employees not really, maybe they have a shortage too. I don't know.
Okay. Well, I can move on because my time is really limited. So I did want to follow up on this program integrity unit.
Yeah.
Defend this man, I guess. It's establish a dedicated program integrity unit focused on fraud, waste, and abuse. Strengthen audit and oversight functions to define methodologies and improve audit readiness. Expand data analytics and monitoring to improve visibility into program activity. Is this going to be under the Division of Public Welfare, or is this going to be under this Division of General Administration?
Correct.
Division
So-
of General Administration?
Correct.
And do you
But
have
it's
anybody
funded.
qualified?
But it's funded, ma'am, it would be funded through CMS, but because it's going to be, it's like an internal auditing, because eyes and ears will be looking at the way the program is executed, it cannot sit in public welfare. It has to sit outside public welfare, so there's some separation and no conflict of interest, if you will. So the Program Integrity Unit will look specifically on programs that are administered by DPW, but it will not sit or have oversight at DPW. It will sit outside DPW in the Division of General Admin, answering directly to the executive. So if they see something, like they do some internal auditing, and they see something that shouldn't be there or shouldn't be doing, like the processes, then it would not be reported to the chief of the Division of Public Welfare. It will be reported straight up to me.
Okay.
Or, I'm sorry, in this case, the deputy. And let me explain why the deputy. Because I am the Guam State Medicaid Director. So even I have to be out of it because they're really auditing my team working the Medicaid program. So they wouldn't be able to answer to me. So what I needed to do is establish a conflict curtain with me, and so they would report all the way to Peter John. Now, Peter John, who's a deputy, you might say, but he answers to you. But there's a conflict curtain that was put up, meaning whatever he finds stays with him, and if he thinks it requires higher level of, like reporting it to the authorities, Attorney General, whatever, he does that without my knowledge, because I am the Medicaid Director for Guam. So there's a conflict curtain that was put up between us. So I hope that explains a little bit.
I want to follow up real quickly on the APDs, the
Okay.
$39 million. Congratulations on that for securing all that federal funding. I know you mentioned that you needed a $1.8 million match. Are you anticipating any other, or have you applied for any other APD funding?
Not at this time. The only APD that's outside that we didn't expect is the $1.5 million from the disaster, but that is because of a disaster, and we're able to apply. But it wouldn't affect this one, this request, because the 1.5 Sinlaku disaster APD, the match would come from what the senators passed, giving the governor the ability, the $25 million, and so she's already approved that. So that wouldn't affect my FY27 ask. But that would be the only thing that is outside the current. We have a lot of work being done, and we can go on and on and on, but we need to get some things implemented first. And so we're looking forward to the biggest implementation, which is really the RFP going out and being advertised for an upgrade after 20 years, the eligibility enrollment system that we're hoping, it's going in a good tick, good cadence. Hopefully when the Attorney General finishes his review and FNS finishes their review, and you might ask why FNS, and this is Medicaid, because we have an integrated system. It's one system that takes care of many programs, so it's an integrated system. So all the funders who are putting money into funding this modernization have to approve the RFP. So CMS is done. FNS is still reviewing it. Attorney General is still reviewing it. Our hope is that by the summer, we will have an approved RFP, and then the next process of the procurement will take into effect, which is really an advertisement. And let's see what big vendors out there that are in the procurement space or in the space for eligibility enrollment will come. But there is a lot of interest right now. When I go to national meetings, Guam is bombarded with interest of help. So I'm excited because that means we're really going to get a competition. And with competition, we're going to get the best product for the best dollar. Unfortunately, in this space, the dollars are in the millions. Sorry.
So under DHAP, I'm reading through your presentation, and it looks like almost all these these shelters and housing, you're anticipating that they will be turned on by the end of this summer. But you have under DHAP 8 positions, I believe, on the staffing pattern, and you have 4 vacancies. Do you need more personnel to?
Yes, always. But I think we have 2 social workers. We have a lot of partners in the community that we partner with. This is a division that partners a lot with different nonprofits. And so we're really in this together. That word, we're in this together. But DHAP is the glue. Is the coordinating glue. Because the different nonprofits only support homeless based on their funding and their funding specifically to what their funding says they should help with homeless. So the government has always been the conduit, right? That has always been what brings people together and then pushes back out, hopefully, the money. And I think, the 1.1 million, the 500,000 in the one section in the last Budget Act, I gave you a breakdown. You'll see, but DHAP staff, social workers, we can always, I don't want to grow too much either, too fast. It's a new division. Like I said, we just finished our strategic plan. We want to be able to roll this out and take care of the homeless the right way with the right pieces in the community in place. We're fortunate enough that the administration were able to buy some buildings, some apartments. And I just want to give a big shout out, I forgot, I'm sorry, to the Church of Latter-day Saints. A big shout out to them because they came into partnership with us and they are funding the majority of all the furniture in the Rancare residence. And I was told yesterday that, what is it, Rob? The washers came in? The dryers were arrived. So, this is a lot of things. Rancare is not ready. We have the elevator, but the elevator shaft is being worked on, and so we can't really open a facility. But the good news is the elevator's here. So we're not waiting for the elevator. We're just waiting for the elevator shaft to be ready to receive the elevator. But it's not only the shaft, but it's also, those of us who know, there is a very few, if not just one, elevator vendor. So we're kind of like in their wait list, in their work order, wherever they're going. So it's unfortunate. I think that's something that people should look into, get into that business, because one elevator vendor on Guam that services all elevators on Guam.
Does your budget factor in the additional costs for opening these facilities, utilities, things like that?
Yes.
It is incorporated into your budget?
Yes.
Okay. And just, I know I asked this before, I'd like to schedule a tour of these facilities so that we can take a look at these shelters and these housing
Yes.
facilities. Okay. Like within the next week or so.
Okay.
Okay. That's it for me now. I do have to go, but thank you so much for the presentation. And
Thank you, Senator. I just want to also say thank you for your support. You've always been open to our department, and I appreciate that very much
Thank
as our
you.
oversight. Thank you.
and I'll be sending the revised bill to you probably by tomorrow. Thank you.
Tudus Masi, Madam Chair, and yeah, definitely, I think we're ripe for an informational. I'm sure you'll find some time in the coming weeks and months. I'll join you on that with a lot of the detail on these programs. I think there might be some interest in the new public health location, so we'll discuss that with you as we go, but I think that's the way to go. I'll join you in that, Senator. Senator Gumatauto, you're recognized.
Thank you, Mr. Chair, and thank you, Public Health, for your robust presentation today, as you described so aptly earlier. Let me start with your property insurance regarding your budget request of $107,544 for property insurance, which is the same amount that you requested last fiscal year. For the record, which government of Guam owned property or properties are covered by this insurance policy? And has Public Health confirmed whether there's an option for these properties to be covered using the same approach that is used for other government properties, such as the Department of Public Works, the mooning facilities, our village mayor's offices, and the Department of Parks and Recreation?
This is for insurance?
Your property insurance.
I'll get back to you on that. Sorry.
I would hope so for the committee as we're looking at the budget. Let me
We
just
have a
move.
list. We will give you the list.
Thank you.
And share it with everybody.
Yes, please, thank you. For your, under your office or the director's office, for the benefit of the committee and those that are following today's discussion, what programs, personnel, contracts, and other obligations are anticipated to be covered with the requested $724,126 for miscellaneous under the DPHSS Director's Office? So what is included in the miscellaneous that cannot be categorized into existing budget lines? Can you give us some examples?
Okay, we do have the breakdown. And so, Ken, if I can ask you to join me. And you're looking at the Division of Public Health. Division of,
It's on that same page with the property insurance, $724,126, page 2-47 in the BBMR document, Schedule E.
if you just give me a minute, Senator.
Sure.
Senator, we can go on to the next question and we'll get that to you.
Sure. Let me just, I know that
And this is the breakdown, I'm sorry, just one more time. This is the breakdown of properties, insurance properties, but the second question you had is?
first one was for property
miscellaneous
insurance.
breakdown.
Yeah, which of the owned properties are covered by the policy? And the second one is that $724,126 for miscellaneous under the DPHSS Director's Office. Okay, let me go to my next question, Mr. Chair, if I can. According to the GovGuam fiscal year 2024 financial statements, this is the audit from the Office of Public Accountability. Through that, they mentioned and reported that DPHSS lacks adequate internal policies and procedures over compliance with the applicable special tests and provisions for provider eligibility. This is the screening and enrollment. I know this is hitting directly to the MIP. And can you tell us what is the value of the uncollected Medicaid provider application fees as were outlined in that audit, and what you can tell us about it?
You want me to answer for an audit question right now, Senator?
There's fees that are outstanding, they're collected, so I'm just want to know what's the value of the uncollected Medicaid provider application fees. It goes in and it's spent in your budget, right? So I just want to know how much you guys are collecting.
I do not have that direct. I can answer that, Director. Okay.
Hi,
The
Senators.
direct-
Good morning, good afternoon. Actually, currently, we do not charge...
Hold on. For the record, can you please identify yourself?
My name is Francine Salas. I'm the Chief Human Services Program Administrator for the Division of Public Welfare for the Department of Public Health and Social Services. We actually don't charge provider enrollment fees, which we are looking because as our Medicaid program grows in just, let's say like 6 years ago, pre-COVID, we were getting a federal amount of roughly $18 million a year. That was our cap. Now we're at $150 million going into FY27, which in that time we've encountered an increase in provider enrollment, an increase in Medicaid clients. So what we've also identified is the need to build a more robust program integrity arm. And part of that is looking at provider enrollments, looking at people when they come, doing site audit visits, because as you know, the specialty care isn't necessarily here, so our clients go off island to the Philippines, to Los Angeles, to San Diego, and they're infants to adults, their ages range. And so
There's no fee charged, right?
right now, in building our program integrity arm, there is a focus on our provider enrollment. And I don't know if you've seen too, just because it's all over the news stateside, there's a lot of focus on fraud within the Medicaid space. And so part of our requirement is to heavily vet these off-island providers as well as the new providers who want to enroll. So we last spoke, I think we were roughly at, I want to say maybe 76 providers that are enrolled with the Guam Medicaid program.
Okay, so which gets me to my next question. Have all the Medicaid providers submitted a copy of their current and valid either business licenses to public health or any type of license to do business here?
Yes,
Yes.
they face so like it's not re-credential, but it is re-credential. It's like every time there's an expiration, we follow up, we send notices, as well as there's an expectation that to receive it before any claims are paid out for their services.
And that's where it was going to kind of a follow-up to an issue that I brought up earlier this year regarding the OPA's findings in their report 2503 on Medicaid providers whose medical and or DEA licenses expired, but who were paid for up to 2 years for failing to renew their licenses. Have these same Medicaid providers provided a copy yet of their required medical license and or DEA license to public health, and were any payments they received while their license or licenses were expired required to be returned to the federal government?
So first of all, no, there's no funding that has been yet required or determined to be returned to the federal government. Second, it might be important to note that the audit period of the OPA audit was 2024. So what they had noticed back, and they're citing 2 years of providers not re-credentialed, that was due to the public health emergency, and CMS had actually waived the requirement to do that. So since that time has happened, though, we've re-credentialed people. Now, individual providers may have chosen to close up shop, may have chosen to retire. However, the service date is what we pay based on, and not if their license expires today. I'm still paying on the service date. The service date was a year before, 6 months before, and they were licensed then. So it really is tied to the service date of when they administered whatever service. And if it happened to be during the public health emergency where the updated licenses was waived, the requirement from CMS's end, we were able to pay them based on that requirement. Going forward, though, everybody has been, all their licenses have been updated. Everything on file we see. And one of the initiatives we're moving towards in terms of modernization is we do have a provider enrollment portal. And that allows them eventually to enroll online or update all their licenses as they come in. Right now, it's just for them to submit and upload claims. But at the same token, this will help us sort of flag and trigger anything coming up, expirations. And I really think that because locally, it's easy. We're here. We can knock down doors if we need to. We can say, okay, well, then we're not going to be a Medicaid.
So you would agree that maybe doing fees would be able to help put that program?
Correct. And that's
Right.
actually something that we are authorized to do under CMS. So.
All right, thank you so much.
Senator, thank you for that message, but just so that providers don't freak out, we're looking into it. We haven't established the fees for providers to come in.
I'm not trying to freak them out, but I think we're trying to cover the costs that are
Correct.
actually borne. And public health can't
And
come and
allowed.
ask, let me finish. They can't come back and say, hey, listen, we're not getting the resources. Here's another way to be able to
Right.
cover that. So that was my point.
Yep. No, I appreciate
okay.
that.
Can
Thank
I
you.
ask for the record, I know U.S. Secretary or Agriculture Secretary Brooke Rollins had asked across the country for SNAP program recipients to reapply for SNAP benefits. For Guam's SNAP recipients, did they go through that? Or I did see something about a waiver, and will our SNAP recipients have to reapply?
We don't qualify for that. That's an exemption for the territories, Senator.
So
We
they're
can
not
get-
going to have to reapply?
Not to reapply. Are you talking about the for SNAP? I'm not aware.
Yeah, and why I just want to know why wouldn't we do it?
It's not. No.
So real quick, Senator, it's not the request to reapply isn't there. It's a renewal on an annual basis, which is basically sort of a reapplication because you got to report, has there been any change in your income? Have you had additional kids? Have some of your kids aged out that they can no longer be covered under SNAP? So there is, there's already systems in place. There's a periodic change every 6 months. A SNAP recipient, head of household, has to report any changes to their income, their life, what's happening that can affect their SNAP amount that they receive. And on an annual basis, they actually need to reapply, and that's sort of how it normally works. It's a
So
renewal.
based on your guys' assessment, compliance rate, just a round number, are SNAP recipients compliant with all applicable federal and local laws? What's the percentage, you think?
So in general, yes, because if they don't come in for their certification, FNS is very, very strict about recertification or updates, and the minute they don't, they get dropped off
So
SNAP.
I'll ask, what do you think is a round number, percentage-wise, that they've done their part? Because we do have those new work requirements and the like.
Are you asking like a rough estimate of those who are in compliance? I would say today, everyone who is currently on the rolls are in compliant. They are very aware of the strict regulations of meeting their appointments face-to-face. And so I think they're getting accustomed to how things are very different about making sure they meet their appointments. For in the past, face-to-face appointments were really forced. Now there's a lot of strict rules for with FNS, and so I can say that the 30-some thousand SNAP recipients today are in compliant, or else they would be automatically dropped after their date.
And that 30,000 has not changed much, has it, in over 2 years? The amount of
No,
SNAP
it
eligible.
has. There has been a dip, There has been a dip of number of clients that get SNAP. There'll be an additional dip with the ABOD folks that are not going to be able to qualify any longer, or they didn't get an exemption. So there is a drop in SNAP recipients, and I think SNAP recipients today know that the federal government is really looking at really honing in compliance and program integrity, and our division is really, we're going to get dinged by FNS if we don't really push that. Our system is so integrated in that the minute they miss an appointment, they get dropped off the rolls. It is so entwined that, and we had to do that. We had to ensure that our systems really comply, or else the program will be dinged. And I think there's, we need the program to continue to exist. We just want to make sure that those who do qualify actually get it.
All right, thank you so much for that, Director, and thank you all for being with us this morning, Mr. Chair. That's all the questions I have, and I appreciate the effort from Public Health on your robust presentation to this body.
Thank you, Senator. Thank you for being here.
Senator Tidigu, you recognize?
Thank you. Thank you, Senator Chalahi. I have an appointment I have to make too. Just real quick, first, thank you so much for this really in-depth presentation. I know you probably can do another, 100 sheets, to explain all the work that Public Health does and fully explain it. But you guys are very good at answering our questions. Appreciate everyone that's here today. Thank you so much. And please send those who are not here today at Public Health, who are working hard, to all extend my adonkalusi masi. Madam Director, just a few questions from me regarding this increase. Can you kind of explain this increase that was not incorporated in here? Again, just so we clarify that.
The additional supplemental, ma'am?
Yeah.
Okay.
And the correct number on the additional supplemental and why?
So when the fiscal budget was submitted, our cap was at 145,000, or estimated cap. We just recently, in April, received the official notice that the Medicaid cap for claims is at 150 million. Okay. So that's a $5.4 million increase in a cap. We remember Medicaid is, we have a match, a percentage match, 83%, 17. So based on the percentage increase, or based on the amount increased, we needed to ask the legislature for the 17%. That wasn't included when the budget went down in earlier this year, the first quarter of this year.
The 17% equates
is
to?
918,000.
I'm sorry?
The 918,000 on the supplement.
Okay, 918,000.
That was based on the Medicaid cap when we received the official notice that it went up to 150. So that's good news, because we got more money from federal dollars.
Yeah, that's true.
But it also means that we needed to come back and ask you folks to help us with the match, because we needed the match.
Which is additional 918.
Correct, for the Medicaid.
But the increase that the chairman was mentioning was $8.3 million increase.
Just point of information, the overall is 8.3, but it's not just for this program. This program is only requesting 977,000.
Right.
There was other
918.
There are other programs that are
for
requested
Medicaid
under the variation.
Okay, thank you so much. Okay, just moving on, the regarding the DHAPP. The funding source for this was federal funds to, it was federal funds. The CDBG, federal, going down the line. Now it says deeds, acquired date and deed. So you were able to acquire the Bradley apartments, you were able to require.
DHAP.
Yeah, these are not like rentals at all. These are buildings that are owned now by the government of Guam.
By the government of Guam,
correct?
Correct.
Okay. That being said, what kind of funding are you setting aside for the maintenance of these buildings?
Okay, thank you. So the government of Guam owns it. We administer the program in it. I think if I'm not okay, here it is on the right page. It was acquired and owned by certain, like for example, the Bradley Apartments, Randcare. We acquired that through Department of Administration. They hold the title. We are the lessees. So as these people go in, for example, we would case manage them, and they say, okay, they qualify, for example, Bradley. We will see, some of them will have vouchers from GORA. We will see, so they are paying for that. So DOA, who is the landlord, is going to be collecting from the individuals who we place there, who more than likely either have jobs or most of them will have probably GORA vouchers. But right now, housing for 1 bedroom or 2 bedroom is so scarce that this fits the need in the community of 1 and 2 bedrooms. But it's for specialty, the homeless, for women, for example. I know you're very passionate about this. For women who are coming out of recovery housing, like from Guam Behavioral Health, and they finished their recovery period, but they have to find a job, find a place to live, and then they can be reunified by their children who we're housing at, for example, some of their children might be in shelters or part of the CPS kids. There has to be a reunification, and the best way to reunify or to make them ready for reunification is to help them find housing. Guam does not have the housing of 1 or 2 bedrooms. This fits the need.
I understand, but the maintenance of these buildings, it sounds like DOA is your landlord. So it's up to DOA to provide funding to maintain these buildings and make sure it's in good order. Is that right? So
Correct.
You guys don't have to worry about that.
No, and
Okay.
And I don't want to speak for DOA,
Yeah.
but I have to believe that part of that rental they're collecting is going to go to maintenance,
Toward maintenance
and things
okay.
like that.
That sounds good. And my last question on that one would be, are you seeing an increase of individuals wanting, needing a place to stay?
Well, the pit count, as we can see, just driving around, especially in Agaña, there's a lot of people. But I have to say, been working with the homeless population, not even just with public health, but through my years in nonprofit work. Some people are just not ready to be housed. And so the question you asked me is there an increase?
Yeah.
We definitely see an increase of more homeless. We're fighting a 35-year addiction. There are women and fathers who are going through programs, recovery programs, who are detached from their children, who are no longer probably have work that they can pay rent or buy a home. So there is an increase of need for 1, 2 bedroom places where we can have them reunified with their children.
Madam Director, can we get a statistics data, start from the beginning? Let's see how many people were there with vouchers, how many you had to turn away, who are actually seeking help within this department of yours. So the numbers will be very helpful, as far as...
As we fill, we're definitely going to get the data points.
Okay.
Right now,
data
we'll
would
have
be
the
very
data
helpful.
points.
Okay, appreciate that. Sorry,
That we'll collect. That we're definitely collecting that. Okay. That's data point that we need to collect.
Thank you. Also, were you affected? Your agency affected on the Dark Lord that affected all the hacking, the cybersecurity attack?
No,
you were not.
Thank goodness.
Okay.
None of our
are you
systems...
on iCloud for all your data and information? Or are you using OTEC?
OTEC, but the goal in the modernization is go to cloud.
Okay, it does go to cloud. Okay.
That's the goal.
Okay. Lastly, on the HPLO, there's always need for like an attorney, an investigator with regard to HPLO. It's really desperately needed. But the one thing I'm very interested in is, and thank you so much for your testimony on the foreign medical grads, the ITP, as well as the FMGs. I appreciate your testimony. Hopefully this bill that's coming on the session floor does not get through because, like you said, it's a great pilot program. And you talk about public health and the hospital. It's the public sector that needs these need these doctors, because many of them do come to Guam, but they go to the private sector, which they'll get paid more, versus if they come to public health, working in our public sector where we cannot turn patients away.
And we are very supportive of that.
Yes, thank you so much. So I'm hoping that whatever the Guam Medical Board of Examiners need to start the rules and regulations, I do have a bill that puts a date and time on it to get it through, but you don't need that from me. You can do it on your own, and I hope you take that initiative to start those rules and regulations so we can get these most needed doctors here to our island so our people are not left behind when it comes to health care. And I appreciate that if you can do that.
I hear you, and the urgency is on our court, and I can tell you that nobody is more urgent to do it than the doctors that are currently on the board. They worked very closely with the National Federation Board to get the best legislation together. And we are guided by them with all the other states that have done this. And so getting the best practices into the SOPs. But absolutely, this bill that allows, or the law that allows us to bring foreign doctors in, is not going to only help the need of the community, but as we mentioned earlier, we send a lot of Medicaid patients off island because we don't have that care here. And that's Medicaid dollars helping another jurisdiction. That Medicaid dollar is not circulating in our economy. That Medicaid dollar, when I send somebody over there to a hospital, that hospital, when I pay that hospital pays in the jurisdiction or the state they're in. It's not circulating here. Unlike when we pay our local providers, they pay taxes, they help in our economy. If they have clinics, they hire people. So it helps in the economy. So definitely keeping people here is the advantage.
Yes, and more so, the public law that just passed that created the ITP and the FMGs, it's a pathway for both the private clinics on this island through the FMGs and the ITP for the public facilities on the island. So there are two options for both public and private on the law that was passed. So thank you so much for everything, and thank you, Senator Chalahi, for letting me take your space. I have to run. Thank you.
Senator Chalahi, you recognize?
Thank you all for your presentation and your work on this. For BOSA, is this 689 number of children in CPS custody, is that an increase from last year?
Oh.
Yes. And is there a delay in paying foster parents?
No.
No?
No.
All right. On the environmental health,
Yes.
We're talking about the need that you have openings and they're not being filled. There's a need for these inspectors in order to increase inspections. Was there a boot camp at GCC for this type of thing? Yeah, were any of those people hired? My understanding is none of them were hired.
So interesting enough, right? Folks have they think they're interested in this arena and they go through the boot camp. It's not a direct funnel to go to the department. Sometimes people take boot camps and then they want to, maybe they think they're applying for other positions in this arena, like maybe EPA, for example. So I don't have the exact data, how many in the boot camp applied and came, but I know that we're always challenged with other departments that can use this kind of Employees and skill set, and that's just our challenge. Unless the boot camp is specifically for just public health, we wait for those folks with that boot camp experience to apply. I mean, I'm assuming that's why they want to get the
Yeah,
experience,
I was told
right?
that they're waiting, they are the ones waiting for interviews or to be
Oh, no.
hired, that no one has been hired from that. But could you please
Did
check
they-
that?
Yeah, I'll check if they're, but we have ongoing recruitments, and the recruitments are year-round. So the list comes to us quickly, so.
All right, and the...
I'll look into that, though.
Okay, please, yeah. The DEH building, the A&E, how was that funded? Is that a grant?
Yes, it was. It was a grant-funded Department of Interior.
Okay. And the SAFE, Shelter Assistance for Elderly Housing, is that also funded by a grant?
Is that Harbor? The Harbor?
The LADA, the elderly?
No. Let me pull it, DAH. Sorry,
No, not DEH, SAFE.
DHAP.
This is on the,
DHAP.
yes.
Right. I'm sorry, one more time, Senator?
Just the funding for how we're going to run the shelter.
The 500,000?
The homeless elderly shelter? Yeah.
The 500,000, ma'am. The 500,000 that's given to part in our budget, this current budget, it's the same. We're asking for an additional 500,000.
Okay, so what was it used for before?
It wasn't used? I'm sorry.
So you had 500 in your budget before and it was not used?
No. The legislature gave us 500,000 for a breakdown. And
For food?
Forgive me, I'm looking for it. Here we go. Public Law
Public
3860. Public Law 3860 gave 500,000 for homeless response and housing, food, and medical. Slide 37.
Yes.
That would be where the money
Okay,
comes from. So it's locally funded.
is that the same as the, oh, okay.
Yeah, that's 500,000.
Oh, so you're going to use that for that?
Yes.
So you're going to use how much? 500,000?
No, the 500,000 on slide 37, ma'am.
Yes.
Shows the breakdown. So that's how we're splitting. There's different housing, there's different needs. So $174,000. Do you see it? Slide 37?
Yeah, well,
Or
are you saying that this list here is the same as, that includes the SAFE building? The shelter for the elderly?
It's the first slide, right? Yeah, that's what I'm doing. It's right here. The Guam Housing Corporation Emergency Shelter, Safe House, that's part of the 500,000, ma'am. That's slide 37.
Okay, so GHC, because on the SAFE slide, it doesn't talk about Guam Housing.
Okay, sorry.
So
Oh,
this,
Guam Housing Corporation is our partner. Sorry
That's
about
with the
that.
elderly?
Yes.
Okay, all right. And then
The elderly and disabled emergency shelter.
And are you running that, or who's running it? Who will be running it?
We manage it.
Manage?
We manage it because we partner with Guam Housing Corporation, and we put the elderly or disabled person into that shelter, and then we check on them daily. We do case management.
All right, so this says people are already in this. So this is not the one that was on TV the other day where they had brought the beds in from the Church of Latter-day Saints.
No, that's RandCare.
Oh, that's the RandCare. Okay.
That's RandCare.
All right, thank you.
Yes.
Okay.
RandCare residents.
All right, makes sense. Okay, then on the budget, it talks about there's in the contracts $9.5 million increase, and in miscellaneous an $18 million increase. And so during your presentation, I was able to catch that maybe 1.4 million of the increase in contracts is for the senior contracts. Which contracts are those? Is that for the villages or 1.4 million increase in
This is
senior
for
contracts?
DSC, senior citizens?
Yeah.
Yes, so again, it's our request is for supportive services. I'm sorry, give me a minute. You're asking one more time, Senator.
Just so there's an increase of 9.5 million in contracts, and what is that for? You said earlier 1.4 million was for the seniors division in contracts, and I'm just curious which types of contracts is increased by 1.4 million.
Supportive services, congregate meals, home delivery meals, preventive
It's
care.
the meals?
It's the meals and the home services, supportive services.
All right, okay, so that's not the daycare or the senior centers, it's not, it's just the meals?
It's just meals.
Okay, all right.
And yes, meals.
And 1.4 million increase?
Yes.
All right, and then the rest of the 9.5 million increase in contracts overall in the department?
Yes, and that's just because of, like meals, for example, cost of meals, cost of food has gone up. Our providers, HSP for home care, their natural increase in salaries, the organic increases in salaries. I mean, that's just the natural, kind of like the increment of cost of living.
What about the 18 million increase in miscellaneous?
For division of...
This is overall 18 million increase in miscellaneous. You had mentioned that you have a 724,000 in the director's office for miscellaneous, or you didn't mention, but that's in the papers. Yeah, so I'm just looking for where's the rest of that miscellaneous increase going?
$18 million?
Uh-huh.
I'm sorry. 18 million? But not at DPW? I mean, not at Division of General Admin?
No, it's not.
No, it's in DPW.
It's in welfare.
Welfare.
Okay, is that your,
You're reading the summary?
Yeah.
It's in the increase.
Yeah, overall.
Is majority in public welfare.
All right, and can you just explain?
Oh,
What do you mean?
SNAP.
Okay, so the
SNAP, the flip of more local dollars now need to be spent in SNAP versus it used to be 50-50. Now we have to cover 75%.
Right. Why is that in miscellaneous then, and not in the regular welfare budget?
And also the APDs in the Medicaid space. The APDs are all the modernization efforts that we got the 39 million for, but the match that goes with that, that's coming down. So that is part of that increase.
All right, what about the 724,000 increase in miscellaneous in the director's office?
That's what she's asking. That's not you.
I'm going to provide you, Senator, that the justification after this, they just can't get into my computer. So once we leave here and I can get into my computer, I have all my notes there. So we'll provide you that.
We'll give you the breakdown on the miscellaneous of the director's
Yes,
office.
for that one, just for that particular one. But for the rest of that increase, it's actually 3 million overall in the general fund, and the rest of it, of course, reflects in the federal match, right? For the matching portion, okay?
All right, yeah, and so that's great news about the increase in the Medicaid cap. Can you just tell us, what do you expect that to go to? Will that go to an increase in patients, or will that go to different services altogether, such as
Thank you
the
for that.
elderly? Or?
Of course, we're going to continue the services we provide already. We are looking at reviewing all the services that might not be used, that we can take off the rolls, so they don't charge because they're not being used. But The increase will definitely go towards, we're bringing online wellness. You know, we need to focus on wellness and making sure that those who are diabetes go down. The wellness checks being covered by Medicaid. Our doula services, because will be covered. We're working on the SPA or the state plan amendment to making sure doula services are covered for the first time on Guam. That will help with female and pregnant mothers. That will definitely go into, we're looking at hopefully having those funds as well touch some increases in doctors' fees. I know everybody's looking at Medicaid and wanting an increase in fees, but we need to just see how that between the doula services, and when I say doctors' fees, I have everyone coming, all Medicaid providers coming into me, whether they're doctors or dentists, asking for the state to please increase their fees. Cannot increase the fees if we don't have the funding. So the $5 million helps. The rebates help. Getting certain codes off the rolls, making sure that codes are being, the right codes are being charged. All that process should help in all the new requests between dentists getting an increase, doctors getting an increase, OBGYNs getting an increase, doula services coming on board. So it is good news, and it seems like a lot because $5 million seems like a lot, and then you add the rebate that we achieved that stretches the cap, maybe another a total of $7 million, $8 million, but we're gonna put it where it needs to be, and we hear the providers asking for an increase, so hopefully we will be able to, after some major analysis is done.
When will you be changing your state plan to make those changes?
State plan takes a while. It takes at least 12 months, if even longer, because CMS today requires a lot of proof that what we're charging is in the right codes, and so it takes about a year.
I know, but
would say.
aren't you in the process of it? So
Some of-
when do you expect?
I'm sorry,
Not till next year?
the doula approval will be this year, this fiscal year.
What month do you do that? Do you make that change, or do you just do it on an ongoing
We've
basis?
We've been working on the SPA amendment with
But do you
CMS.
change the state plan annually, every year, or do you do it any month you want to?
No, when we need to.
Okay.
At needed and as we get
All right,
guided
so
by CMS.
has it ever been changed recently to include this elderly assistance living that we talked about during one of the hearings?
That is one of the things that we're looking at Medicaid, and we are in the process of making the state amendment so that when folks go into these residents like RandCare, if they're Medicaid, then Medicaid can pay for it.
All right. Well, these changes then, I want to know, do we max out the use of the Medicaid every year?
Last year, we were up at 140 some million. So we touched the cap, but we didn't go over the cap.
Okay. So that's good. Do we have a waiting list of people who want services and we have to deny because we're at our cap?
No.
No. Okay. So, all right. So we kind of have the luxury of including additional services versus cutting anyone off?
But we also need to be able to prove we can afford it within the cap.
Okay.
And so the additional cap, the rebates, turning off certain codes, making sure that providers charge the right codes and not the wrong codes that have higher charges, all that matters in the analysis that CMS before we can turn on another service.
All right. Did you submit an application to increase the cap, or that was automatic?
That was given to us.
All right. All right. And then a couple more things. I heard you talk about who's moving where, environmental health. Where are they moving? DEH?
You mean in
So some, like you said, the admin is moving to the new, I think,
DH
auto spot building.
in RandCare, in Hessler. DH will stay there for now, part of it. But Director's Office and Division of Public Health
Are moving to your new space?
to the new space.
The auto
But
spot. Is that-
everybody else will
So are
stay.
you still going to be paying the rent at Hessler, the 600,000?
Not, it's going to be proportioned out. DEH, whatever DEH square footage, they will pay for it.
All right, and then the new rent?
Well, that's going to come out from what we used to pay
Hessler?
DOA. Yeah. It'll just come out of our
600,000.
budget, like
Same?
normal.
So you're saying it's a wash?
Same.
And are in the Magaʹhågan building, I met with DPW and they, in February, because I was told through all the testimony that contract that we paid $1 million to assess, and they determined it should be refurbished, and they were working on the design, and they estimated it would be $27.8 million to actually refurbish it, but they were finishing the design, which was due in February 26, 2026. When I met with him, he said he had given the contractor a 30-day extension, but that all the parties had agreed on the design. Do you intend to move forward with that this fiscal year?
Well, one, we need to find the money, and I think the new public law that moved GCC, the old public health building to GCC, that new public law now, the Magaʹhågan Central, what it's normally called in the past, is now owned by GCC. We will coexist there. We have an MOU already in place, and I think the financing arm, that's the whole rationale, is GCC is going to find the financial arm. So definitely we're in partnership with GCC to coexist with their nursing, but that financial arm will be on them to determine.
All right. And that you agree with DPW that you agreed with the design?
Well, the design was just my design. It did not include the annex. So it's going to be, we agreed with the design for our part, but not the annex for the nursing for GCC. Because remember, that design did not include GCC at the time.
Oh, no. The design he showed me had public health all on the first floor and GCC on the second floor.
Yes, so maybe, he's probably talking to GCC without me, but I know my part, we're good.
All right.
We like the design.
Okay. And, all right, then just this the homeless shelters, can you just explain again why they took so long? Everybody has seen, particularly the Anigua building, has been worked on maybe years ago, it's been years. And like you said, some of these were acquired in 2021, 2024, and it's really just taken a long time while we really have a growing crisis.
Right.
And they don't seem to be opening yet. End of summer 2026, end of summer 2026. Yeah.
Okay. So I can only say that it took long because they may have acquired it at the time, but ADA requirement and refurbishments needed to be conducted. All the construction to make it ADA compliant, because every room has to be for a wheelchair, because we're expecting frail, elderly in that case. So all the ADA, all the construction, that's what's delaying it. And then we needed to furnish it. We found a partner, thank goodness, for the Church of Latter-day Saints. That's in. So things are just coming in, we can't open it without furniture. We can't open it without, I can't open it today, even if I wanted to, because the elevator is not in yet, for example. The Bradley apartments in Anigua, we're waiting for range hoods to go in.
What?
Range hoods?
For the stoves?
Stove ranges.
How long you been waiting? Because that building we've had in our possession since 2021, it says.
Thank you, Senator. That's your time.
Yep.
Please answer the question.
We are pushing it along as fast as we can, and we have a lot of people ready to move in, or at least identified to move in. But You know, I'm not the landlord, I'm not the holder of the lease, and so all I know is that the delay was caused because of some construction, ADA compliance issues, and equipment and stoves being installed and things like that nature. So
Thank you,
all
Senator.
that. Thank you.
That's
Thank you,
DPW?
Therese. Yeah.
DPW you're saying is the landlord? Who's the landlord?
Thank you, Senator. That's your final question.
Yeah,
We'll have
if you
the
could,
answer. Yeah.
Mr. Chair, this is a 2-hour, we waited for these questions.
I understand, ma'am, but
yes.
we've been fair with everybody with their 5
Yeah.
minutes, and we can have another hearing on that. But
Well,
this is for the budget.
This
Go
is
ahead.
the budget.
Yeah.
If it's-
I know you want to engage, Senator. That is your time. Thank you. Therese, you
could-
can answer the question.
It's there, Senator. Your
The landlord?
Is
the
DPW
landlord is there
DPW
on
the
the
landlord?
on the chart. If you look at the
Oh.
chart,
Thank you,
the
Senator.
landlord is there. and-
DOA?
DOA.
Yeah, thank you. So Therese, on the budget, I just want to make some observations and a couple questions as I close. So as we look at the general fund, because that's really what matters here, is the general fund request. You are obviously administering the federal funds, and it's a great benefit to Guam. So just an observation, fiscal year 2025 expenditures and encumbrances, basically you closed out at 63,779,305, and then your authorized fiscal year 2026 level is 72,330,000, basically about an $8 million increase. And then we're tracking that again for this year in terms of the request. Of course, we have the matching requirements for Medicaid and the like, and other presentations that you made. I just wanted to make that for the record that we have been supportive, and the track is on the same in terms of being able to avail at a maximum level for
Yes,
those
Senator.
programs.
Thank you.
So, yeah,
And we
so-
appreciate that. Thank
Sure.
you so much.
So what we'll do is we'll evaluate, like there was some questions in
Yes.
different divisions. We'll evaluate the final ask and then maybe send some follow-up questions to
Absolutely,
you.
and
Yeah.
all the senators that asked, and
Sure.
thank you for the 5 senators that actually came to my budget
Sure.
hearing. I appreciate it. We have the, staff is here, we have the notes, and we'll definitely get back to you and, of the
Yeah.
responses.
So we'll send follow-ups. I mean, the Medicaid's pretty straightforward,
Yeah.
and I'm sure most of them are. I'm just saying that so we can have details for when we go into the committee of the whole
Yes.
and debate the budget, and when we do the final in terms of general fund.
And-
Just a couple of questions. Oh, good.
Okay. Senator, and again, the budget session is expected in July?
Yes,
Okay.
we will start just right after the 4th
So
of July, and we are planning
we'll
to
definitely be in
vote by
discussion
July
before then.
17th. Yes.
Together,
Yes.
we will
Yes.
Chair, can you clarify if the program integrity unit, new unit, is a federally funded or locally funded new unit of the department?
It's federally.
Okay.
Federally
Yeah.
funded. Thank you. I have a question on page 22. This kind of jumped out at me, and I wanted to ask this because I know that I've heard from different jurisdictions by others that I talked to in stateside in terms of the effect of the Big Beautiful Bill and those programs being administered. And a lot of them under this, as you mentioned, the effect of the 75% and also the effect of the waiver without the dependents having the waiver, they've worked with their Department of Labor and other programs to ensure that they could work with these clients to meet those requirements. Are we doing that here as well?
We're doing that. We have a partnership with Department of Labor, but also many of the clients, for example, the able-bodied folks that have to now prove that they have to do 20 hours, whether a week, whether it's actually paid work or volunteer, they're really going out on their own, I have to say. They're going out and volunteering in churches, they're volunteering in mayor's offices, they're actually getting part-time jobs, and a lot of them are getting the exemptions as well, right? So, yes, there is a lot of folks that we are expecting to drop June 1st, about 6,000, as I mentioned. But also the Division of Homelessness is ready to help them where we can.
Sure.
With food commodities and, wherever we can, we're going to help.
Yeah, the
We're
reason
one
why,
department.
yeah, the reason why I ask is because I know that we have a reported relatively good news on our Department of Labor report in terms of unemployment. But on the private sector side, when we talk to the businesses and others, they talk about needing employees badly, right? And so probably, I was talking to a couple of businesses and they said, they're anticipating maybe a surge in applications and the like through this program, and what
Department
what
of
the
Labor
benefits
program?
change. Yeah, well, no, that the benefits change. They're anticipating that perhaps to meet the requirement, they're going to get maybe a lot more applicants, right, in order to stay on the program, but meet the work requirements, right? And so I just wanted so that we can work on this together and maybe envision this and get some synergy here.
It's there
Yeah,
already,
yeah.
Senator. We're already working with them.
Yeah.
We not only work with them we have our own SNAP employment education program, but we're also working with Department of Labor to see, SNAP and Department of Labor already have a working relationship.
Yeah.
So we're
No,
definitely.
I know you're a mandated partner under Workforce Investment.
We already
I
have
got
a
it, yeah.
partnership with them.
Right.
Like I mentioned, this new ABOD requirement that's going to hit us June 1st.
Yeah.
A lot of them, majority of them, have exemptions and are actually complying.
Yeah.
So that's good news.
Yeah, so I just wanted to give you the feedback that I'm getting, especially from the private sector.
They're expecting some.
Well, and the thing is, not only their expectation, but the thing is that what they're looking at and what they're finding now, because I tell you, a lot of businesses, their operations do ebb and flow. Not all of them have full-time jobs for a long
Correct.
time, right? So a lot of what they're looking at and what they think they might be able to do here, which is a perfect relationship under this need for that work, is have a consortium of employees that need to work part-time, so that they don't, they're not, they themselves also have to pay, less benefits and the like when they have part-time, but those who are subsidized under these programs, at least for an interim, seems like a happy marriage. So I'm just saying that, the more we get the word out, the more we work with the private sector through Department of Labor and Public Health, perhaps we fix a problem that currently exists, or even the private sector. They don't really need full-time employees for a long period of time, but they need this rotation of part-time employees, and with more than one full-time or several full-time, where they know they have a flux in terms of how their business, just like the tourism industry, namely right now. We know that Sinlaku set us back, right? I'm sure operations in Tumon had to, peel back for a while there was not much demand, but then they fire back up, right? And we're coming into summer, so there's probably going to lead a lot of employment. I'm just saying that while we look at the challenging side of this, I'm asking for also a push on the opportunity side. That I'm not saying you're not doing it, but maybe a bigger emphasis, knowing that this is the implementation now with this program.
So noted.
Forward.
Yep.
Thank you.
We'll make sure.
Thank you. And I really only had one other question, and now I gotta find it. What happened to me? So that was that program. You know what? It must have not been important enough, and maybe I'm too hungry.
But you can always ask it, and I'll
Sure.
get back to you.
We will send you some follow. Like I said, we'll send you follow-up questions on the breakdown. I know that OFB is continuing to push forward on examining the detail of that request. But like I said, on most of the matching, it's basically a no-brainer because of the programs that it brings forward. It is lunchtime, and we're going to go ahead and adjourn this hearing on public health and consider their budget for 27 having been heard, and it is 12:19.
Thank you, Senator. Thank you so much.